Hey folks, it's Dr. Sam, and I'd like to welcome you to another Eye Clarity podcast. Well, we have a fantastic show today, and I think I'm going to get right into question one. So, this is a question from Chad, and he is suffering from a condition called spondylitis. His doctor wants to prescribe a medication called Acthar, and he's concerned about uveitis. So there's a lot to unpack here. Let's start here. First of all, in spondylitis, this can be a type of arthritis. Sometimes it actually can affect the spine. And as I said, it's an inflammatory response. The drug of choice, Acthar, is actually not a steroid, but it is a pharmaceutical drug that helps our body produce its own natural steroid hormones. And so Chad is asking, should he take this drug? What can he do to maybe reduce the risk of uveitis? And so what I would say is that, whenever you suffer chronic inflammation, any pharmaceutical drugs that you're using are kind of a band-aid approach. And in the short term, it does break the inflammation cycle, but in the long term, using any kinds of medications can in fact cause side effects. So if we look at Acthar, for example, I'm looking it up, some of the side effects can include actually things like stomach ulcers, changes in mood and behavior, irritability, depression, trouble sleeping, acne, dry skin, bruising or discoloration of skin. I mean, this is a common story when we're faced with taking pharmaceutical drugs, which is the disease-based paradigm. In my world, what I would say is that if you, Chad, if you want to really change this around, the question to ask is, what are you doing to reduce the chronic inflammation? If we talk about uveitis for a minute, uveitis is a condition in the eye. The uvea is the internal lining of the eyeball, and it actually can affect every structure, everything from the iris to the ciliary body to the choroid, which are more of the choroid is more of the covering, the internal covering of the eye. But uveitis can even affect the retina, the vitreous, the optic nerve. And over time, if you have chronic uveitis, you are more susceptible to getting conditions like cataracts, macular degeneration, and glaucoma. A lot of it depends on where the inflammation is in the eye. And if it's in the front, the center, or the back part of the eye, uh, wherever it is, you're going to get symptoms like eye redness, floaters, blurred vision, and even pain. Now, there are two types of uveitis. There's the non-infectious type, which is more based in the area of autoimmune problems. And so we've got two things here. We've got the autoimmune factor and we've got the chronic inflammation factor. And I'll get back to those in a minute. So spondylitis would fit into that non-infectious type of uveitis. Rheumatoid arthritis would be another reason why we might be developing uveitis as an autoimmune disease. Now, the other type of uveitis is more of the infectious type, and this is where if you have Lyme's disease, TB, even a condition called H. pylori, which more and more people are suffering this. It actually takes place in the upper intestinal tract, and it creates chronic inflammation in the intestinal system. So in this particular case, I think in the short term, Chad, I would probably go for the medication. And then I would begin to really investigate where your chronic inflammatory responses are. And the first place that I would look would be, the microbiome. And I talk about this, other prominent doctors speak about the importance of the good bacteria in our gut. It may be that you suffer chronic inflammation in the microvilli, which could be the lining of the intestinal lining of the intestinal tract. This leads to things like leaky gut syndrome, candida, and this is where it starts. So, going to a functional medicine doctor and really getting an evaluation on what's going on in your intestinal tract, I would add things like toxicities. I see a correlation between being exposed to things like Roundup from the company Monsanto. The glyphosate is a terrible toxic agent that can affect our intestinal health. Eating GMO foods is another factor. And we're not even talking about gluten, dairy, and sugar, which you should be getting off of anyway. Making sure you're getting prebiotic and probiotics in your diet. Again, a functional medicine doctor could help you with that. Now, in terms of the eyes, there's some nutrients that I think are very important, things like astaxanthin, the marine carotenoid. And again, if you're going to do supplements, I would do somewhere between 6 to 12 milligrams of astaxanthin, about 20 milligrams of lutein, and about 6 to 8 milligrams of zeaxanthin. So those carotenoids are so important for our eye health. Bilberry, omega-3 fatty acids, and especially the DHA in the omega-3. And I would probably take between 2,000 and 3,000 milligrams of omega-3 every day. Another one I really like is resveratrol. This is a potent antioxidant that actually helps improve and protect the nerve cells. It reduces oxidative stress. And you'd be looking at taking about 150 milligrams a day of resveratrol. And then there are things like ginkgo. Another one top of my list is glutathione. And in glutathione, because of the chronic inflammation in the eye, I would probably take about 500 milligrams a day of glutathione. Curcumin is another great antioxidant and anti-inflammatory agent. Green tea extract. And then one of my faves is the MSM. Now, if you can get MSM eye drops, I would use those. I'll get to the eye drops in a moment, but I'm even considering for you somewhere around 2,000 milligrams of MSM powder per day. I think that would also be helpful. I would consider getting some craniosacral therapy and also some acupuncture to see if you could reduce some of the chronic inflammation and boost your immune system. And, last but not least, your visual stress is very important. So my eye exercises would be really helpful. It's a complicated situation and there are many levels and layers to it. But I think that if you take the medication in the short term and you change your diet and you reduce your stress, I think you have a good chance to neutralize some of the risk factors that are causing the uveitis, which is probably triggered by the spondylitis and the chronic inflammation pattern. So, Chad, best of luck to you. Thank you so much for the question.